if someone suffers a stroke, one of the most important things that we do as a stroke team is identify why they had that stroke. It's been easier because of imaging of late to know definitively that the person's had a stroke on MRI. It identifies it very quickly, very easily, but that's only 10% of the picture, I would argue. Meaning, yes, now we can identify you've had a stroke, but we need to figure out why you had it and how to prevent it in the future, which is much more important to the overall health of this individual. And that's a tougher question to answer. And what we do on our stroke service is we run a series of tests while the patient's in hospital, usually over a day or two. So very quickly, we work through the various possibilities that could have caused their stroke, which include looking at the arteries in their neck and their head to make sure that there's not plaque. Same plaque we talk about in people's hearts and other arteries in their body can form in the arteries in the neck and head and block arteries causing stroke. We look for arteries that might be damaged from trauma or other things with these same images. We also, of course, use MRI to look at the brain tissue to make sure that they don't have underlying genetic disorders that might lead to further strokes that we could potentially treat or ward off. We look at their heart with specific tests that, again, identify risks that could cause stroke coming from the heart. And after doing all this, we then check labs that look for their cholesterol counts to assure that their cholesterol is well controlled. Of course, throughout the whole stay, we monitor their blood pressure. Again, if they're found to have high blood pressure, we start medications that would work to lower that pressure as they exit out of the hospital and hopefully go home or to rehab. We look at various factors about smoking and stopping smoking, having people counsel them. And if they're diabetic, we have diabetic counselors and of course, specialists who come in and talk about good eating habits, exercise, and those types of things that can control your blood sugars if you're a diabetic patient. All of those things happen in the hospital, but it doesn't just stop there. The continuity of care is very important for stroke patients to continue those trends throughout their whole lives. So we start medications to prevent stroke, and then we follow them up in clinic, usually shortly thereafter. And there's a very set and strict guidelines that we use to assure that no one falls through the cracks and that they receive their medications and screening tests that they need to continue to try to protect them in the future from having another stroke.